Before we ask you any more questions, let's have the audience put on your 3D glasses again. We're going to show you a brief clip from a documentary that we're making tonight, and it's in an area that has been inspired and influenced greatly by the work that Dr. Michael Black has done. Please put on your glasses.
Our group is researching techniques to perform motion compensation for beating heart surgeries. In order to avoid stopping the heart, the surgeon can perform the surgical act through small holes on the patient's thorax. So through these small incisions in the patient's body, the surgeon defines a region of interest. We are able to estimate its motion in 3D. The robot tracks this motion and moves synchronously with the beating heart motion so that the surgeon can perform his gesture as if he was operating in a virtually stable environment. The problem here is actually the volume of data that you have to treat. The heart moves at very high speeds, so therefore you actually have to visualize the heart motion at a very high speed. In order to do that, we have to acquire images at a much higher frame rate. That demands a lot of computational power. Until very recently, we didn't have the computational power to process these images as they count. It was only with the GPU that this became possible, because before, the computational power was too expensive, or it was simply impossible to perform the algorithms that were needed in order to achieve this. What actually motivates us to keep working towards this, such a system is the possibility of expanding the motion compensation for beating heart surgery to enable surgeons to perform even more complicated procedures, or procedures that today are not possible. We're actually hoping to do something that is going to change medicine, so that's going to provide surgeons with more possibilities.
Wow.